Hi, everybody. Thank you so much for joining us. I am Lisa Fox, the Principal Investigator of National Center for Pyramid Model Innovations, and we're excited to have you with us for the Implementation and Scale Up webinar series. So I'm going to be the host of today's webinar. So the topic today is what it takes. How do you build a statewide infrastructure to address the use of exclusionary discipline in early childhood programs? And I invited two panelists to join me. I'm so excited. We have Alli Lowe-Fotos from Illinois. I'm going to have both of them tell you a little bit more about their background, the work they do, and the organizations they work with. So she'll share with us about Illinois and their journey with this, and Dominic Paz from Oregon State University, who will share more about Oregon. So Alli, why don't you introduce yourself first?
Thank you, Lisa. Yes, my name is Alli Lowe-Fotos, and I am a senior policy manager at Start Early. And I've been with Start Early about 10 years now on our Illinois policy team. But my background is in clinical social work, and before making the switch to policy, I always worked directly in programs with kids and families, doing lots of different things, case management, family support, home visiting, infant and early childhood mental health consultation, and direct therapy with kids and families. But I really feel like I use a lot of the same clinical skills in my policy work, and my direct practice work definitely informs my policy work. And I always talk about kind of the intersection of all of those. But because of my background at Start Early, I focus on our mental health work, our home visiting and doula work, and early childhood expulsion, which I'm here to talk about today. Thank you.
Terrific. Dominic.
Thank you. It's a pleasure to be here today and share this time and space with everyone, talking about a very important issue. My name is Dominic Paz. I'm right now in Portland, Oregon. I am the manager of the implementation support team at the Early Learning Systems Initiative, ELSI, at Oregon State University in Corvallis, Oregon. I came to this position just through all my work over the last 20 plus years, working as I've been an education coordinator with the Early Head Start, where I learned just a lot about coaching, parent educator with an info system to support families in raising their children, accessing resources, and I've been a state inclusion specialist as well. And also when I first started at LC, I was in their coaching supports core. And that's where I started. I use a lot of the information and experiences that I've had over the years in connecting with families and spending time and space with children, and also connecting with adult learners. I'm also recently was accepted into the Early Childhood Policy Fellowship at Bank Street. And so now I'm a fellow in which I am cherishing all the connections that I'm making and learning that everybody is doing this work across the nation.
Thank you. Thank you both for your lovely introductions. It makes me feel like, and I'm sure the people who are listening, like we have two panelists who really understand their state system, policy, and the daily work of supporting young learners and their families. So it'll be a great talk. Now, remember, there's a Q&A panel, and you can put your questions in it at any time. And when we get to the end, I'll pull those up. So you will have a chance to pose questions. I'll pose them for you. And we'll try to get to as many of those as we can as we have our discussion. So I want to start just to set the stage of what we're here to talk about. And we're here to talk about exclusionary discipline that's often suspension and expulsion. And the Office of Civil Rights recently posted the last set of data. They've been collecting these data across multiple years around preschool suspension and expulsion. And it was disheartening to me to pull it up. and see that our numbers are not getting better. We have more children in pre-K, but we have a large proportion of children in preschool that are experiencing suspensions and expulsions. We see disproportionality in who experiences those suspensions and expulsions, and very disturbing data around preschoolers with disabilities served under IDEA who have a federal entitlement to be in a program and to receive special education services and supports, who are being also suspended and expelled from their programs. So this tells me we have a ton of work to do. And I know those of you who are here listening are here because you want to join us in trying to do this work, in trying to make a difference to ensure that each and every child can belong and be a part of the programs their families have enrolled them in. I think one of the concerns about suspension and expulsion is the impact it has on the child who has behavior that challenges adults. They lose instructional time, access to peers. It compromises their relationships. I think we also need to think about the impact on peers who see that some children are valued and other children are rejected when they are perceived as being different or behaving in ways that they can't be included. And for the peers who are witness to a child being suspended or expelled or often leaving the classroom with soft suspensions, for children who are witness to that, what they are witness to is when a child is in distress, that child is pushed away versus pulled in, right? Because they have to leave the room or leave the school or leave the program. And we know from our research the impact on families and the stressors that it puts on families and family systems, in addition to just the notion that a child is being pushed away from the program rather than pulled in and being supported. And so the impact of exclusion immediately is significant, and longitudinally, the impact of using exclusionary discipline, we have some longitudinal evidence and research that says for children who are suspended and expelled early in preschool program, that trajectory can continue and it can lead to really poor life outcomes for young children. So big problem, takes big solutions. And a part of that solution is around policy. And so I want to invite Alli to kind of start us off. And Illinois has been held up as having a really remarkable policy, and that maybe you can tell all of us kind of the story of the policy and what has happened in Illinois around that.
Yeah, thank you. I do feel like our policy is great and remarkable, but I am not shy to highlight the challenges and the problems associated. There are different ways to approach this. You can start with a high-level policy, kind of the top-down approach. You can start from the ground up. I think both are really great when done together. Needing a policy from the highest level, but then making sure you're building the system and the supports from the bottom up as well. But in Illinois, back in 2014, when all the federal attention started sparking conversations, it really sparked it internally in Illinois. And a lot of us advocates, we wanted to get ahead of legislators because a lot of times legislators will catch wind of something, they want to address it, but they aren't necessarily the subject matter experts. They don't always consult with the subject matter experts, and they might have someone just draft something that's not wonderful. And so we wanted our efforts to reduce expulsions to be really comprehensive and include all of the early childhood system, so that guidelines and best practices were closely aligned across the board, but also that it should be a collaborative effort statewide, incorporating as many partners as possible. So a group of us advocates kind of got together, a lot of organizations, including Start Early, and we began drafting legislation that pulled from a lot of best practices and sources like the Head Start performance standards. We circulated it with other partners, advocates, programs. We got feedback from our Governor's Office of Early Childhood Development, our Illinois Association for the Education of Young Children, Institutes of Higher Ed, our Infant Mental Health Association, the Head Start Association, the NASW, parent advocacy groups, the Black Child Development Institute. We also consulted school management groups and education reform groups, unions, and of course our state agency partners, legislators, and then definitely providers and programs. We incorporated all this feedback to revise the legislation, and we introduced it in Springfield in 2017. It did pass the House and the Senate with a lot of support, and it was signed by the governor in August of 2017 and went into effect January 1st, 2018. We felt like the legislation was pretty groundbreaking in that it did apply to the entire early childhood age range, so birth to 5. It's not referred to as preschool expulsion legislation because it does go all the way down to the 0 to 5 age range, and all of our early childhood settings. So childcare, state-funded pre-K, and of course Head Start and early Head Start. We also feel like it's innovative because it does make reference to implicit bias and the racial disparities and calls for training around a lot of these things. There's a big parent engagement piece. It asks that data be collected across systems and that all of our state agencies collaborate together. And so the goals of the legislation were to ensure that early childhood programs engage in best practices in their disciplinary actions by prohibiting expulsions of young children due to their behavior. Also to connect providers to existing available resources and supports to address the various needs of kids, and to track transitions due to child behavior so that we can provide better data to better understand the issue and identify the need for additional resources. Next slide. And then in the spring of 2021, our Illinois Black Caucus actually introduced and passed the Education and Workforce Equity Act, which the governor then signed into law. And this law signified really broad public support for providing the social emotional strategies and supports that are needed to support implementation of the expulsion law. So access to things like pyramid model and infant and early childhood mental health consultation, those things are critical to ensure the social and emotional well-being of our youngest kids, especially those who have experienced trauma. And through this legislation, the governor approved the allocation of Governor's Emergency Education Relief Funding, or GEAR funding, for the elements of this act, which calls for a continuum of supports across infant and early childhood mental health. And so because of this legislation and funding, Illinois was able to provide more funding for cross-systems coordination of pyramid model and expansion into more sites, and then also to double the amount of consultants, infant and early childhood mental health consultants that we had available to childcare programs. Next slide. But after the legislation is passed, that's not the end of the story. You know, you can't just check a box and say, we fixed it. The administrative rules then need to be written, which kind of elaborate the requirements of a law or policy. And this process can take years. Starting in 2018, the advocates worked with the state agencies to write the rules, and those were just finalized in late 2020 and early 2021. So programs were basically in a gray area for a while, and actually many still are. The rules are not perfect. The state agencies didn't take all of our advocates and providers and family suggestions, and we're still working with our state agencies on things like guidance and best practices, data collection, providing more resources to programs. And so we really have to monitor implementation of a policy. For the past few years, advocates have partnered with Dr. Kate Zinser at the University of Illinois, Chicago, to use her research to inform the rulemaking and development of guidance and best practices and any revisions that we might need to make to the legislation due to unintended consequences or, workarounds. And I have a link here in the slide to her most recent and detailed research on Illinois expulsion and suspension, which really indicates that exclusion is actually still happening at disproportionate rates. So boys, children of color, children in child welfare, and children with disabilities are still more likely to be expelled. So the passage of our law did represent a really important step forward in eliminating expulsion, and we have made some progress. Like I mentioned, the increased funding. But we still have a long way to go, as evidenced by these reports. They're fascinating and just still disheartening in a lot of ways. So as rooted, in best practice and as intentional as our policy can be, it impacts people in different ways. There are unintended consequences, and the effects may change over time. What works now may not always, because systems change, funding changes, community changes, and people change. So we really need to just be in it for the long haul and be reflective in our policy making.
Thanks, Alli. That I think is so important for all of us to know, right? I think we believe if there only could be a law that would fix it and then it'll get fixed. And yet, I think you just provided a very compelling illustration that, this is a piece that takes a lot of time to make progress. So, Dominic, share with us what's happening in Oregon and how policy is driving what you're doing.
Yeah, one angle that's unique to my perspective is that when I was part of one of the advocacy teams that was supporting to get these bills in legislation. And I have been able to experience it from that advocacy piece, and also now in the systems piece, and also from a family perspective. I'm also a father with 2 children. So I think that's very unique with Oregon, and also in Illinois, we have these similar, I guess what we would call the bans. And that's one thing I'd like to address first, because that's what really caught a lot of people's attention, was the word ban on these House bills and state bills. And I think the better way to approach it is these are bills that are looking to provide wraparound care in supporting early educators to support those children whom they are experiencing challenging behaviors with. So it's House Bill 2166. That is the bill that is going to create that system of support in the form of a program, which is still under development at this time. And that program is going to serve children from birth to age 5, and also be able to support the early educators. I think is where we lose focus sometimes in supporting the children and developing the skills and experiences they need to be able to be in those spaces. And I'll also add that what a lot of the impacts that Alli had mentioned in Illinois, we are experiencing the same ones in the positive sense, where it is making an impact. And I am seeing systems begin to change in the early care systems in Oregon. Can we go to the next slide, please? Okay, so the bill states Bill 236. That is the bill that does identify that an early care and education program that's receiving public funding cannot suspend or expel children. Again, that's the bill that provides the goal, and then the House bill is the one that provides that support. And as we get into what that begins to look like, can we go to the next slide? As we develop a support system for early care providers and professionals across the state of Oregon, it's important that we have the system at the table. A lot of the support has been created, but it feels like it's in silos, and organizations doing the same work parallel. So in order to be meaningful with how we're providing support, who you see on the screen there, we called these agencies together in organizations. And we developed the Oregon Early Childhood Inclusion Initiative. And it's dedicated to ensuring that all children, including those with disabilities, have access to inclusive, high quality early learning environments. We recognize that being able to be successful in providing the support, we have to have our systems together, collaboration, is one of the pieces that is what makes our work not only meaningful, but also providing the supports that the communities do need. What's important to also recognize is that from this early childhood inclusion initiative, we developed the state leadership team, which we'll talk about a little bit later. And in that process, I think what was very moving to see was these organizations come together. They've been together for a few years now as the state leadership team. Started out messy as all large groups may, but the growth and connection and relationship that we have developed and continue to develop to engage in this work has been I think our strength right now as a state leadership team. Again, this is the system of supports that we are trying to develop across the state of Oregon.
That is an impressive number of logos. And so as a system of a support, is that the Early Learning System Initiative? Is that kind of defines this group? Is that, I see that logo down there on the bottom as well.
Yeah, so the Early Systems Initiative, the ELSI, that's coming out of Oregon State University,
Okay.
and we are part of the web as well. And we will talk more about that later in the webinar.
Okay, great. Well, so let's do that. Let's move to unpacking some of the elements for this really ambitious work and how states are building those supports. So you want to start with the Illinois story, Alli, again?
Yeah, so there are so many best practices and resources that are needed to address early childhood expulsion and suspension. But in order for these supports to work, I've said before, it really does take time, and we need to be proactive, before a situation really reaches a crisis point. Pyramid model is one component in a multi-component comprehensive approach to address the issues systemically. You can go to the next slide. And so in Illinois, we do have some of the supports and structures in place to support the legislation. As far as pyramid model, we have been a pyramid model state since 2017, and we have a strong statewide leadership team composed of public and private partners. There are, I think, about 20 to 25 of us on the statewide leadership team, so lots of logos as well. And we have over 128 implementation sites who are supported by coaches with training in the pyramid model framework. We have at least 25 pyramid process coaches. I think we may have more at this point that are in the professional development network. And our current sites are predominantly in our state-funded pre-K, but also in our childcare system, Head Start and Early Head Start, and actually branching out into the early intervention system. Next slide. We also have infant and early childhood mental health consultants, and this is just kind of a snapshot from our consultant registry that shows kind of their reach. We also have a joint pyramid model and infant and early childhood mental health consultation advocacy group that kind of began out of some technical assistance a few years ago from the Pyramid Model Consortium. And we've kind of stayed together in joint advocacy as our state is kind of going through some transitions, which I'll talk a little bit about later as far as opportunities. So these are just a few of the supports that we have in place. I haven't even gone into detail in some of the inclusion work that we have in the state that is also supporting some of this. But these are probably two of our stronger supports that we have to address or support the legislation.
That's great. I did that initial slide you showed with the long list. It reminded me of the Rosemary Allen and the Children's Equity Project did a publication called The Holistic Framework that I like to look back at that has this whole array, right? It takes a whole array of components to really address this. And obviously
Yeah.
the silver bullet.
Yeah, a lot of those bullet points we take from all of the research that's gone into it from Walter Gilliam, but also Rosemary Allen and the Children's Equity Project. Those are great resources to show how much it takes to really comprehensively address the issue.
Yeah. So Dominic, tell us a little bit about the structure in Oregon as well.
Yeah, so like I mentioned earlier, we have we're going to revisit the state leadership team that again was developed out of the Oregon Early Childhood Inclusion Initiative. This just graph, I'm sure some people are familiar with it if you're familiar with some of the ECTA materials, but this is the guide that we are following to break up our work and address the development of resources to distribute throughout the state. It has the state leadership team. I'll talk about our professional development network and how we provide supports, the implementation communities and programs. And then we'll talk a little bit about data a little bit later as well. So we can go to the next slide. We'll talk about the state leadership team. This is just to show some of the key achievements that have happened over the last few years. So expanding a cross-sector team to implement the ECTA indicators of high quality inclusion and also pyramid model framework. And I want to emphasize that cross-sector team piece, because again, it's that collaborative piece that in my experience really does get the work done. That collaboration that you make, that you can participate in and develop that relationship to really understand what the needs of the communities are. And my team at the Early Learning Systems Initiative at Oregon State University, ELSI. We are in the process and have been for the last 2 years in supporting communities to implement the pyramid model framework throughout the states. And so that has required us to develop a lot of trainings, but I'll talk about that team in just a moment. The other achievements that the OECI that has been a part of is just kind of understanding the distribution of resources and getting communities and state leaders together to talk about what the potential of blending, braiding, or sharing resources. That has been a valuable touch point that I have observed in our state leadership meetings. Also creating mechanisms for job-embedded professional development learning and developing those learning resources as well, especially for those serving young children with disabilities in the public and privately funded early care environments. And when we get to the next slide, we can talk about this last piece as well, development of capacity building supports and resources for community-wide implementation. Can we go to the next slide? As we talk about those levers that, one of the many levers that support the web of support in the Oregon Early Care System, this is ELSI. A lot of the work that we have been doing on my team in the implementation support team for the pyramid model framework, we have been developing trainings, providing trainings, pyramid model trainings. We've offered over 20 trainings on pyramid model. We have also provided trainings on the national indicators of high quality inclusion for communities, programs, and classroom teams, helping the early care environment really begin to dig in and understand and be with the inclusion indicators in order to really understand them and ask the questions and be in the room with them to at times to be able to answer those questions, because we know how important those relationships are to not only our learning, but everybody's learning. And as we embed, as we implement, the pyramid model framework throughout Oregon, we know that it has anti-bias learning embedded, right? So not only are we able to provide access to these types of trainings, but we have also expanded it in developing a series that's called Building Anti-Racist Learning Spaces, specifically for early educators. and it has become part of our training packages that we have developed. Again, and we're talking about the elements, and this is one of the levers inside of those elements is also collaborating and working together with a university as well over at Oregon State University. Next slide, please. And then this is just an example of the trainings, and this was just last year that our team had organized, developed, at times translated. We've also been able to translate a lot of this specific training material as being responsive to communities who had requested it, that we had noticed through surveys, but also just having that relationship with them and being able to identify what their specific needs are in that community. And so that's where a lot of the translation came from, was just a response to those communities asking for it. And I think it's important to recognize that our outreach coordinators on the implementation support team played a critical role in that. They would connect with community inclusion teams, community leadership teams, program coaches, sometimes in person, to be able to not only build that relationship, but to really understand their specific communities and really understand what those specific needs are, because it's going to look different from community to community. And that's why I think our outreach coordinators really played that critical role in connecting not just the state, and connecting the state leadership team to the actual work on the ground, information going up and down. I think they were critical. One thing I'd like to point out on here is that we were able to, in Oregon, provide the pyramid model e-modules. That's always hard for me to say with those both words, for free to all Oregon professionals for the next 5 years. And so, and one additional thing about the trainings that we are able to provide is that the early educators and professionals, they don't have to pay for our trainings. There's no charge for them, and they still qualify for the extended learning that's needed for our industry. And as we look into that support network, I like to talk about the community teams implementation. So I'm manager of the implementation support team. They are out there. Those are the outreach coordinators that I was speaking about in our last slide. And this just kind of lists the supports that they're able to provide that have been valuable in getting these types of trainings, not only into those centers or into those classrooms, but also being able to interact with the information in the ways that support their own learning. So there's those monthly coach and program support meetings where it can be a call. Again, a lot of the team that and in the lead up, they are able to meet at times in person, which does make a huge impact. And I understand not everybody is able to do that depending on resources. But as we were developing this team and our budgets, we were meaningful in allocating funding for in-state travel for implementation communities, to get to implementation communities, because we recognize the value of building and fostering that relationship in this work that we're doing. We also are able to have an annual end of year celebration event where we come together, talk about our work, but we also have a party-like atmosphere to celebrate all the wonderful work and connections that have been made over the years. And then there's also webinars that about early childhood inclusion that my team not only develops, but provides. And along with communities, I wanted to introduce our implementing pyramid model and inclusion indicators frameworks. This, we were able to also get it translated in Spanish because one of the communities we were working with, it was upon their request, and we recognized that if we can get that material in the early educators' language, it's going to be more meaningful, more impactful in their learning. And that QR code will take you straight to that implementation guide. And what's unique about it is When we developed it, we brought in communities from the moment we started to develop it. We brought in, we did not develop the manual first and then pass it out to them to ask what they thought about it, but we made time and consulted with them and were able to have them in that manual as well. And they were also able to share stories. So there's a bit of storytelling that happens in this book that really does ground the work and really does put that feeling of what we are doing in this work, which is really making a positive impact for children and families.
That's so great. I've looked at the manual and I do think storytelling really helps connect, right? Knowing how it happened somewhere else really helps me conceptualize how it could happen in my community. This is great. I'm glad we're talking about pyramid work. Before we move forward, because you have a little bit more, both of you, to share about your pyramid work, and we want to talk about data a little bit and what's next for each of your states. But before we go there, I want to ask both of you a question, which has to do with, you mentioned that both of you mentioned infant and early childhood mental health consultation in your state system, as well as pyramid model work or a multi-tiered system. So you, in your models for state prevention or state support, so that suspension and expulsion or exclusionary discipline practices aren't occurring, that is an important element. And that has come up in quite a bit in the literature as well. So I wonder if you each might say a little bit more about that intersection, because I think it's very important. You know, do we leverage infant and early childhood mental health consultation to do this work? Do we need to have different levels of reaching out? Like if I'm not in a pyramid model center, where do I go? What do I do? What happens if I feel like I'm in crisis? But maybe Alli, can you talk a little bit about how y'all are using it? And Dominic, then I'll pass it to you.
Yeah, it's a both are needed. We get that question a lot from like funders and legislators, that everyone wants a silver bullet, and they're like, if I'm going to throw money behind something, what is it? What's going to fix it? And the answer is all of it is needed and beneficial. It's really nuanced also. The two go really well together. We have lots of sites where the best practice is that you have both. You have an infant and early childhood mental health consultant who's very well integrated into the organization's leadership team around pyramid model, and there from the beginning. There are times when a program might need or access one more than the other, or to your point, Lisa, if they're not a pyramid model site yet, you know, how can they access all of the other supports? So that's hard to explain sometimes, where it's like a case-by-case basis almost, but the important thing is that the both interventions and all of the interventions are available at a scaled up model for programs to access as they need. And to Dominic's point from earlier, to their community and families' wishes. You know, each community is different, each program is different, each family is different, and so what they need varies. And so it's important to still have that statewide support at a scalable level that can be adapted. For those who aren't as familiar with infant and early childhood mental health consultation, it's another resource for staff. People often misinterpret it and think that it's like mental health professionals coming in and working directly with the child, which isn't true. They can do observations, they can meet with families, but it's primarily a support for the staff. What we like to see is that it's brought in proactively, not at crisis point, and that unfortunately is often when they are brought in. You know, a program has already been working with a child for a long time and they're at their wits' end, they're ready to kick this child out, and they're like, I just need my mental health consultant to come on in and kind of sign off that it's okay to, and our mental health consultants are like, oh no, you know, and there's a space for them at the crisis level too, you know, they can be utilized in that way. But our Illinois model for infant and early childhood mental health consultation is really partnering with a program from the beginning to work with the staff to build their capacity and staff at all levels, you know, the director, the administrator, the teachers, there's consultation within home visiting programs, all of those things. And they work really well together. And there are coaches with pyramid model, but the coaches and the consultants also don't do the same thing. So yes, there are plenty of overlaps. Consultants can, you know, work on classroom practices as well, but it is a different approach. And pyramid model coaches have a very reflective background and process, but that's where the mental health consultants maybe lead a little more around the reflective practice and kind of building the staff's capacity around that.
Great. Thank you for sharing that. So fascinating. Dominic, what is it? How's it used in the structures for Oregon's work?
Well, I think right now that as they are designing that that program of support, that is now being designed as far as what that support's going to look like, and we haven't seen it yet. But I have all confidence that I think one of the most important things that Alli also had mentioned is that two things is that training and capacity building from all levels in the organization, because that then leads to shared language and shared understanding of those challenging and at times of crisis, right? You're so able to communicate. And one other thing I think about is as my team and Elsie has been supporting early educators in that perspective of having being able to just be with the children. I think about how our trainings, we look to also front load and embed those skills within those trainings without having to take a moment to identify them clearly. But throughout all those trainings, as we know in pyramid model as well, that anti-bias lens and that equity lens is embedded throughout the program. So I think about that front loading piece and high quality trainings, and we talk about that. And high quality again is also subjective, but I put it to a goal when I say high quality, which just means a meaningful training that is going to be supportive or address a specific support that we were able to identify from those connections with the communities, with the CLTs or CITs as well. And I think mental health consultancy needs to be a part of the system, definitely, with that specialized knowledge, along with teaming with the classroom and the trusted adults in the classroom. I think that's an amazing support team to have. But I think to Alli's point, she said they're not always connected, right?
Yeah.
So as we work forward, looking to wanting to make those connections and make those meaningful connections, because we know the work that we do together also comes out with the work that we do with children and families.
Exactly. All right, I'm going to go back and we'll go back to our slides and talk a little bit more specifically about the pyramid work and how that's going in each of your states around suspension and expulsion. So Alli, you have this slide around what you're doing in Illinois.
Yeah, I apologize that this slide is very tricky to read. I know it's small, it's a lot of info. The stuff on here is not as important for you to like process as more of my description of it. But kind of what we're looking at as a state around pyramid model and what role it can play, we do use the Pyramid Model Implementation Data System, or the PIDS system. And our statewide leadership team is really trying to hone in on our data to look at challenging behavior and staff responses. We're looking at our benchmark of quality data, and we can see that pyramid model growth in programs, it's ongoing and it's nonlinear. You know, it's not always like you start here, there. We know that achieving sustainability of pyramid model, that really takes time, especially for our newer and less resourced programs like our child care and our family child care programs and Head Start. We're also looking at our teaching pyramid observation tool data, or our TPOT data. And we're seeing that programs show the lowest scores in intentional teaching scales, such as teaching behavior expectations and social emotional skills and competencies. And here, these graphs, you can see an example of our behavior incident report data, or our BIR data. This is summary data for all programs, and it's showing that physical aggression was the most frequent challenging behavior that we've seen right now. And the most frequent response is for the staff to provide verbal reminders, but that the motivation for those behaviors is most unknown to those who are completing these BIRs. The challenge here is that not all of our programs in the state use the PIDS system right now for the BIRs. Some use their own data collection tools or the BIR spreadsheets from Pyramid Model. So it's great that we do have as much information in PIDS, but it's definitely not a complete full picture of all of our implementation sites just yet. However, all of this is really helping us do kind of continuous quality improvement. So one, is the data being entered correctly? Do the people putting in this information, are they interpreting it, the questions in the same way and entering the same information? Once it's in the system, how is that data being interpreted? And then how are we using this information to show which areas staff and programs need professional development or support in? Next slide. And so this really leads me to talk about, sorry,
I'm getting there.
just talk about the overall kind of state level, the opportunities that we have in Illinois to really sustain, embed Pyramid Model, but also expand it. Our governor has long been a champion of early childhood, and we are actually now in year 2 of his Smart Start Illinois plan. So Governor Pritzker announced in the FY24 and also the FY25 budgets unprecedented increases in funding for childcare, preschool, home visiting, and the early intervention program. We are a bit in a tricky spot now. We are facing a state deficit in our budget, so that's we unfortunately got a lot of like level funding this proposed budget. But we are very lucky that we have a governor who's long supported and understands early childhood. In the fall of 2023, the governor also announced a proposal to create a new unified early childhood state agency to centralize our early childhood programs into a single newly formed state agency, which would really catalyze on the goals of the Smart Start Illinois plan. Because currently our early childhood services, they're split across multiple agencies. But on July 1st, 2026, Illinois early childhood programs currently overseen by 3 of those state agencies will move into a new cross-sector agency, the Department of Early Childhood. And so this current transition process that we're in and the establishment of this new agency, it really provides a huge opportunity to support changes, coordination, collaboration, and support that pyramid model framework and the emphasis on social, emotional, and mental health needs of kids. And then ever since the passage of our expulsion legislation, there has been a multi-year effort by a group of public and private partners to really investigate what it would take to set up a behavior support line. We've learned a lot from other states, like Arkansas has a really impressive behavior support line. And so really trying to make recommendations and kind of map out the beginnings of what it might take to set up a behavior support line. And these recommendations have been taken to our Transition Advisory Council that is kind of monitoring and leading the implementation and the transition and the setup of this new agency. And so that's been a big opportunity there too. Because as we know, I've said this before, there's no such thing as a quick fix or an easy answer to this challenge on a systemic level or even on an individual level. When we think about all the possible causes to the problem, we don't want anyone to take away that there's just one thing that is to blame. A lot of times when we're talking about this issue, it comes across as if we're blaming the programs or the providers, when in reality, there's so much going on at the macro level. Expulsion and suspension is the perfect storm of a family situation and behavior, that child's behavior, the program's response, but then also that macro level and those systems conditions that are there kind of operating in the background. So as I said, policymaking, it really should be this continuous reflective process. And in Illinois, I do feel like we've made a lot of progress, but we still have a long way to go. But luckily, we do have a very committed, sometimes small group, but very committed group of public and private partners who just continue to try to work on this all the time.
I love that you shared this as opportunities, and that you reminded us about this is really quite a huge, long journey to address this issue, because a lot of times we just want to get it done, and we're not going to be successful if we go into it with that mindset. All right, Oregon, tell us more.
So again, referring back to talking about times where we're doing this great work in the same state, but doing it in silos. We listening to, again, the communities, took on the project of developing a Oregon pyramid model and inclusion indicator frameworks implementation map. So this is a live and active map that you can screen that QR code. What you see there, it's going to be updated every time we add somebody, or somebody can also put in information to let us know if we didn't know that they are one of those communities. But it's a map where it's interactive, so you can roll over it. It'll pop up information from each. As you can see, the counties there, they're arranged. We are using cohorts as the organization for these counties, but all together it includes 19 counties altogether who are either implementing, about to implement, or curious about implementing in our county. So that's Oregon has 36 counties altogether. So we are more than halfway there. And at some point, I'm sure that map is going to be very colorful. But again, this is just to support those communities to connect, especially in that eastern part of Oregon. It's very rural and very difficult to connect just because of the environment, and providing a map like this helps those communities connect and support each other when the opportunities are there. And then I'm going to touch upon PIDS as well. Oregon is new to PIDS. We just got it in our state almost 2 years ago. And at this point, because it's so new, we don't have a lot of information or data to show. But what's also neat is that back data that we've had, we're able to put that in at this point. We have built out a data point for the inclusion indicators as well. And I think that's a bonus about PIDS, is it's can be adaptable which is great when you're supporting all communities, because there are times where some are not showing up in those columns, so to speak. So you can adapt it that way. We're also building out a dashboard for the infant and early childhood mental health consultation as well. But PIDS is going to be that piece of data where we can just have that continuous improvement and be able to monitor our work, see where we can do good or do better, and where our challenges are. That other QR code is about our translation. So in supporting communities, we have also invested in translation. This is an example of some of the translation that we have done, not even to this point. There's even more there. The QR code would take you to all of those resources, but just in our first year, we had translated 83 pyramid model resources. Also partnered with Idaho to get translations, and we have also partnered with NCPMI to be able to receive and share translations. If you scan that QR code, you'll see that feature at the bottom of that, but you can also access those translated training materials through that QR code as well. Translation piece was very important, as it was building that relationship, and I would say at times repairing that relationship that has historically been built with the communities, and having these materials available in their home language really supported them in being seen and feeling a part of their own community and providing this type of support at the highest level.
Thank you, Dominic. This has been a great conversation. We're out of time. We only actually had one question that was about navigating the system, but and I asked my burning question. So hopefully that was okay with everybody, but I want to thank you so much for sharing. We're trying to keep this to just under an hour so someone could actually listen to it on your lunch break. So I'm going to ask Victor, who's our tech person, to give a little bit of information. I want to thank both presenters, and hopefully we'll have another one of these a year from now and hear about all the growth and the amazing progress that you've made. So thank you so much for coming and sharing.
All right. Thank you very much to our panelists for their wonderful insights. Your feedback is very important to the work that we do. So please remember to provide your feedback on this webinar with our post-webinar survey by typing the web address shown on this slide into your internet browser or scan the QR code. Your certificate of attendance will appear once you submit the survey. We invite you to visit our website, challengingbehavior.org, to sign up for our upcoming webinars, access recordings, download pyramid model resources, and more. We thank you to our funders for making this webinar possible. This concludes our webinar. Thank you all and have a great rest of your day.